Every older person should be able to live well with dignity and independence as part of their community and in a place of their choosing. Australians expect a choice of appropriate and affordable aged care services when they need them. These services must be high quality and responsive to the diversity of need. The Royal Commission into Aged Care Quality and Safety has shown that we are still far from this ideal in Australia today. The government now has a responsibility to all Australians to ensure that the recommendations of the Royal Commission are translated into actions. Therefore, it is perfectly reasonable to ask the Australian Government to make the necessary changes that will assist aged care to meet service provision, safety and quality goals. This should include reform in the areas of governance and regulation, funding and pricing, clinical care and workforce. Governance and regulation of the aged care system needs reform. Government funding should prioritise public good, be directly related to safety and quality regulation, and address areas of market failure. Aged care boards require greater diversity to support better governance and stimulate much needed cultural change in the sector. Legislative change is needed to strengthen regulatory actions for aged care providers who breach their duty of care. Annual spending in aged care should be increased, but this should not be offset by reduced spending in other areas of the health portfolio. An aged care independent pricing authority should be established and areas of market failure should be identified, whilst improvements in transparency of reporting are also needed. Additional investment is needed to support general practice in aged care. Holistic care could be encouraged through the establishment of new MBS items aimed at bundled care for aged care residents. Additional spending should be directed towards increasing aged care staff numbers, improving their pay and employment conditions, and improving qualifications through professional development opportunities. If you would like to know more, the Deeble Perspectives Brief, Translating Aged Care Reform Recommendations to Action, can be accessed by navigating to the Deeble Institute section of the AHHA website or by contacting the AHHA.